Our bodies constantly operate 24/7 to carry out crucial processes that keep us alive and well. We can do all sorts of things as long as we are fit and healthy. But how do we know if we are still healthy? When do we know if we've gone past our limits? Well, our vital signs help us with that. What are the vital signs? According to Johns Hopkins Medicine, they are the measurements of the body's most basic functions: pulse rate, respiratory rate, blood pressure, and body temperature. Each vital sign has its own literature values. Any value that falls outside the literature range often denotes underlying pathology. So, how do we measure vital signs correctly? The pulse rate is the number of heartbeats taken in one full minute. There are 9 pulse points in the human body, but we usually take the pulse rate in 2 main pulse points, the brachial pulse and the carotid pulse. When taking the pulse rate, we consider the following characteristics: rate, rhythm, symmetry, contour, and strength. To get the pulse rate, have the patient sit down and ensure that they are calm and have not engaged in any physical activity for the past 5 minutes. This is to ensure that the pulse rate will not be elevated. Place the 2 fingers, index and middle fingers rather, on the radial pulse or carotid pulse. Do not use your thumb to measure the patient's pulse rate, as your thumb has its own pulse and it will result in an incorrect pulse rate. For infants, take the pulse rate on the apical pulse. Count the number of beats in 1 full minute and record it. Take note of the pulse's qualitative characteristics as well. The respiratory rate is the number of breaths taken in a full minute. This is usually taken unconsented. To take the respiratory rate, have the patient sit quietly and make sure that they are calm and unaware of the doctor taking the respiratory rate. Observe their chest and shoulders rise and fall. Count the number of breaths in 1 full minute and record it. 1 full breath equates to 1 inhale and 1 exhale. Blood pressure is the force exerted by the circulating blood against the arterial walls. 2 numbers are recorded when measuring blood pressure. The higher number, or systolic pressure, refers to the pressure inside the artery when the heart contracts and pumps blood through the body. The lower number, or diastolic pressure, refers to the pressure inside the artery when the heart is at rest and filling with blood. Both the systolic and diastolic pressures are recorded as mmHg, or millimeters of mercury. To get the blood pressure, have the patient sit comfortably with their arm resting on a flat surface at heart level. Ensure that they are relaxed and have not consumed caffeine or smoked within 30 minutes. Place the blood pressure cuff around the upper arm about 2 to 3 centimeters above the elbow. Inflate the cuff by squeezing the bulb until the gauge reads about 20 to 30 millimeters of mercury above the student's normal systolic pressure based on their history or estimated blood pressure. Slowly release air from the cuff and listen with a stethoscope placed over the brachial artery. Note that the value for systolic pressure is when the first sound is heard, and the value for the diastolic pressure is when the sound disappears. Record the blood pressure. The body temperature is the measure of the body's internal temperature. It can vary depending on the person's biological sex, food and fluid consumption, time of day, and stage of menstrual cycle in women. To get the body temperature, ensure that the thermometer is clean and functional. Place the student in a comfortable seated position. Measure axillary temperature by using a digital thermometer. Insert the thermometer under the armpit and leave it in place until it beeps. This usually takes around 30 to 60 seconds. Record the temperature. Knowing your vital signs will help you detect any underlying medical problems. Make sure to measure your vital signs 3 to 4 times a year or as necessary to keep yourself on track with your health.